Good morning, everybody. On behalf of the NAHU Education Foundation, I would like to welcome you to the last webinar in our webinar series on the new healthcare landscape. I'd like to introduce for you today both of our panelists. First, joining us today is Chuck Alston. Chuck is Senior Vice President and Director of Public Affairs at Corvus MSL Group. Corvus is a global public relations firm, and Chuck works on public affairs, marketing, policy, and reputation issues for diverse corporate and nonprofit clients with a specialty in health and medical issues. He also works on the healthcare quality portfolio for the Robert Wood Johnson Foundation, which is the nation's largest philanthropy devoted solely to health and healthcare. He also advises hospitals and health systems on communications around delivery and payment issues. In addition to we also have Janet Trotwine. Janet is Executive Vice President and CEO of the National Association of Health Underwriters. Chuck and Janet, thank you for joining us, and I'm going to turn it over to you. Thank you.
Well, welcome all of you here to our 26th Capitol Conference and our final webinar presentation through our series with the Robert Wood Johnson Foundation. It has been a pleasure and a privilege to be able to bring this information about making real change to all of our members and the others who may be watching this. We have in today's presentation, we want to sort of wrap up all of the things that we've done in prior sessions. We want to go over some of the information that we've done before to repeat some of the most critical information, but most importantly, we want to help you understand how to take the information, how to go back and catch up on any information that you might have missed and take it back to your clients or use that knowledge to help you make changes for your clients. We encourage you to make sure that you don't think that this doesn't apply to you, no matter what your market focus is. It's very, very important that we do something about escalating costs. As you know, health insurance is expensive because health care is expensive. We say that to you many times over, and it's just as important each time we say it. So it's very important that we do something about that. That's why we entered into this project with the Robert Wood Johnson Foundation through our Education Foundation, and we were fortunate to be able to find a great project like this that allowed us to also collaborate with our members and other brokers in the community who can use and benefit from this information for themselves and their clients. So what I'd like to do is just kind of start off with what is it that we've created, a little overview maybe of what we've done. And I guess I would just tell you that if this is the first time you're watching this, that's okay. You can go back and catch up. We have arranged for you to be able to get continuing education for watching this series. So we're enticing you in every way we can because that's how important this information is. So learn it, become familiar with it, and use it in whatever way you can in your community. And I'll just turn it over to Chuck now to talk about what this is that we've assembled here.
Thanks. It's great to be here with you, Janet. And one of the things that I've learned on this project is that the folks watching this webcast and the folks in this room are the folks who are trying to make the healthcare economy work for the rest of us. So it's a real honor to be doing this today and to be here with you. 2 years ago, Janet and Deborah Cook of the Foundation and I sat down to discuss whether it would be possible to do an initiative to educate brokers, advisors, agents, and consultants about the new emerging changes in the healthcare landscape. As any of you know, it's changing with dizzying speed, the way we deliver care, the way we pay for care. It's really a landscape that's in total upheaval. To echo what Janet said, we realize not everybody can affect payment reform change in their market. You can be at the mercy of the insurers. Not everybody has large self-insured clients. But we wanted everybody to become conversant in what's taking place in the healthcare landscape. And so to do that, we hatched this project. The initiative was launched by the Foundation in 2015. We actually launched it at this conference last year. It consisted of a 10-part webinar series. We had 8 articles that we placed in the Health Insurance Underwriters magazine. We developed a toolkit that's principally what we're going to talk about today. It was underwritten by the Robert Wood Johnson Foundation, our partner, and our intellectual partner was Catalyst for Payment Reform, which is an independent nonprofit working on behalf of employers and other purchasers to catalyze improvements in how we pay for care and also advocates for transparency.
So I'm going to stop you for a second. So when we talk about our intellectual partner, a little bit more about Catalyst for Payment Reform, this is what they do. You can see from their name, this is their mission is to explore ways to change the way we pay for health care. And they have such a high level of expert resources, and Suzanne was wonderful in leading these. I think you'll really enjoy her remarks, even if you're just going back as a review of these webinars. She was just outstanding in really framing in a really easy to understand way what all of this means.
She was the co-presenter on 8 of the webinars, and the co-presenter on 9 of the webinars was Mark Gagne, so we'd like to thank him as well. For those of you who missed the webinars, let me just give you a brief overview of the type of material that we covered. The first webinar was an overview, really, of the cost drivers in healthcare, the variability of price and quality by both provider and market. Anybody who's looked at the United States can see that prices are wildly varying depending on where you are. And it's the same with quality. It varies wildly by market and even by doctor's office and even by hospital in the same town. So that's what we covered in the overview. Also looked at the cost of healthcare. Webinar 2 covered transparency. We looked at the changes that are taking place with both carriers, with Medicare, with consumer groups, with others who are advocating for transparency. We took a look at what some of the vendors in the market are doing. A lot of y'all are working with people who have very innovative products now. They're getting it both from employer databases, from some cases carrier databases, some cases like FAIR was developed by New York State as a settlement up there. So we looked at a lot of the tools that are out there for transparency. Webinar 3, we looked at the different types of value-oriented payment that are taking place. We looked at things like shared savings, accountable care organizations, pay for performance, shared risk, bundled payments, reference pricing. Anybody who's following what Medicare is doing has seen that Medicare is on the cutting edge of this. A lot of the big carriers are now not only launching their own accountable care organizations, but they're trying things like reference pricing, bundled payments. Anthem in California has been a real leader in this, working with CalPERS and some of the other outfits out there, Safeway. Webinar 4, we looked at value-based insurance design, and it featured Dr. Mark Fendrick of the University of Michigan's Value-Based Insurance Design Center. Mark walked us through how value-based insurance design can help consumers and your customers differentiate between high-value services and low-value providers. And as Janet mentioned, anybody who's worked with a formulary that gives you a better price on generics kind of understands what value-based benefit design is. And what Mark's trying to do is carry that into other pieces. I also heard it said this morning on the first panel, some people are now looking to combine high deductibles with HRAs as much as HSAs, and there's some reasoning behind that because you're limited in what you can exempt from the deduction. Under one device, you're not from the other. One of the things Mark and his group is advocating for is to give more freedom to waive copays and deductibles, for instance, for like a diabetic who's covered by a high deductible plan.
Right, for example, just to reiterate that again, because I think this is something that may come back, the issue of if you have an HSA product, the limitations on first dollar care, right? And so that's why this is being looked at, is because the idea behind value-based purchasing is that you might actually do some upfront coverage, first dollar coverage for diabetic care, for example, or treatment of high blood pressure, or things like that would keep people from becoming ill.
But that's the level of nuance that when you have 10 webinars, 90 minutes apiece, that we have time to get into. We couldn't get as much in depth in the magazine articles, but in these webinars, we really get into the nuances of these issues. Webinar 6, we looked at the issue of inappropriate care and what payment reform can do to try to resolve some of the inappropriate care. Some people say as much as 30% of the care is unnecessary or wasted. And we looked at that principally through the prism of maternity care and of imaging and some of the efforts that are going on around the country. As examples, that's right. Webinar 7, We drilled down on how you can assess your local market's prospects for types of payment reform. Suzanne Del Banco walked people through the various types of markets. What's it mean if you have providers who can call the tune? What's it mean if the carriers are calling the tune? What can you do if you have large purchasers? I mean, she looked at all the various combinations, and she talked about tools that Catalyst Payment Reform has developed that we'll talk a little bit about later, that you can go on and access for free. In some cases, you have to acknowledge a user agreement, but you can access for free. And even if you're not in a position to field your own survey in your market, the tools are very useful for giving you a framework to think about your market, because you have enough interactions with what's going on to understand that without a survey sometimes.
Like what questions to ask,
right.
What things to think about. And so there were a lot of little nuances like this throughout this entire webinar series. And I just want to go back for a second to the inappropriate care for a moment and just give them an example of, if you haven't watched these, about how in-depth this thought process is. So when we talk about inappropriate maternity care, just to use this as an example, you probably think C-sections or regular deliveries, right? Much more in-depth than that. It also goes into whether or not you have induced deliveries, and the rate of which you have induced deliveries that are done for convenience purposes as opposed to being medically necessary. So these are it's not just these black and white areas. There are a lot of gray areas in all of these topics, and those are the things that we really need to equip ourselves with more knowledge about. And so you might see some of your carriers and other vendors that you work with. I think we'll see a trend in this where we're really getting more into educating people earlier on in the process about these things. And this is what we want you to be prepared for it. And if you really watch these webinars and think about them and let them probe your own other questions that you might have, you will benefit a lot. Don't multitask while you watch them. Well, I know that you all will do that, but I think it's watch them in depth as for your own thought process, because the biggest thing they can do is make you think about what other questions you have, not just these things that we don't want to just tell you the way it is. We want you to think about this and have it to spur other ideas.
In webinar 9, we had 4 of your colleagues talk about things that they're doing in their market, and there's some very interesting ideas emerged. One of your colleagues is running Dutch auctions for a carve-out for pharmacy benefits. Another one was actually running negotiations with the local hospital on behalf of the largest employer in the market. Others were trying to do things, as we talked about earlier, where you could try to structure some of these high deductible plans where you could get around the first dollar coverage issue for people with chronic disease. So we really got into some interesting things in that webinar. And then finally today is the 10th webinar where we're going to explore the toolkit, and that's what I'd like to do now. And again, to remind you what Janet said earlier, all these things can be watched for free, and pretty soon they're also going to be packaged up into a continuing education program where you can actually get credit, I think, in every state except for Alaska. Is that right?
And we haven't given up on Alaska.
Now let me turn to the toolkit itself. What we did is we took all the content we produced along the way, all the slides we did for the webinar that were appropriate for your repackaging and reuse. We took all the articles we wrote, and we tried to say, what in addition to that could we package that would be useful to you? So it starts, and the idea, by the way, as we'll get into this, is things that you can rebrand. We didn't do this so you're showing my work or Robert Wood Johnson's work. Everything we've done that we want you to use for educational purpose with your clients and in the community is things, and it's structured in a way where you can put your logo on it. And if you don't like the words I wrote, these things are in Word format or PowerPoint, you can noodle with it. We wouldn't want you to get way off the beaten track.
It's not locked up as a PDF. Yeah. We're going to give it to you in a format that you can manipulate and personalize so that it'll be appropriate for your groups.
To package the toolkit, the Foundation has introduced a new landing page on the NAHU Education Foundation website. There's a tab over to the left side. And the landing page is called The New Healthcare Landscape, How to Make It Work for Your Clients, a toolkit for brokers and advisors. The heart of the toolkit are the slide decks. And we're going to get into each one of these tools a little bit more in depth one by one. But the heart is a series of slide decks, and I'll cover that more in depth in a minute. The second are what we call broker briefs. We took 6 topics that are in wide discussion in the market today, and there are 6 of the things we had written HIU magazine articles about. We repackaged them into what we call broker briefs, which are little 2-page documents that you can use. Let's say you're invited to make a speech. And maybe you want some of those facts like the ones Janet used this morning. Well, we developed, I think, 1,500 words of talking points. So if you need to go out and make a talk about payment reform or the cost in the healthcare market, there's your talking points ready. Again, you don't maybe like our words, but you might like the sequencing, you might like the anecdotes, you might like the information that's in there, and it just may be yeast to start your own thinking process. One of Deborah Cook's favorites, and she leaned on me to do this, is the infographics. We produced 3 for topics that we think are in wide discussion today. We'll get to those a little more in depth in a minute. We have links to all the toolkits that I mentioned earlier on the Catalyst for Payment Reform site, and there's a little overview document that explains what all the tools are. It provides links to them, and it tells you how to use them. And again, that's the market assessment tool. It's the model contracting language. It's information on, what you should put in an RFP to an insurer. So there's lots of links. And again, it may not be that you actually use the products in toto, but it may give you some fresh ideas for thinking about things that you can do. One of my favorite things, and this isn't something we developed, this was developed by another group, we'll get to it in a minute, is a glossary. It's really a rich document, like 50 pages of every term you've ever heard in terms of payment and delivery reform. If you're not quite sure what shared savings is, you go in there and it'll give you chapter and verse on it. Very useful document. And finally, we developed a resource guide because a lot of the things we covered in the webinar, we realized you may want to read up more on your own. And again, I'll talk about that a little bit more in a minute. We'll look at these tools one by one. Again, how do you find it? The New Healthcare Landscape. It's a special landing page on the NAHU website. The heart of the toolkit are the slide decks. There's a couple different versions. What we call the master deck is 57 slides. They're all there together. Then we did 4 separate decks where we carved out separate topics. We did one on payment reform, we did one on price transparency, we did one on the state of healthcare, we did another on value-based insurance design. And here's the idea behind this. It's not that you're going to go present 57 slides. I mean, we know that. Nobody's going to stand through that. But it's in a format where you can download it and you can grab the ones you want. Maybe you like that cost slide, but you don't like this cost slide. Maybe you like this slide explaining variability and quality. Maybe you like this graphic on reference pricing. Maybe you need a little information on bundle payments. So that's the idea. It's not that you're going to take them all, but that you can pick and choose and use the ones that make sense for you when you're on your way to do a presentation. And, when we talked to people on the advisory panel, they told us they may be invited to talk to the Chamber of Commerce. They may want to do special presentations for their largest clients on what's going on in the healthcare market. They may want to go talk to a community group. So, it's clearly, we're a foundation. We didn't do this to develop a business development tool, but it's got all kinds of purposes for your own businesses. And I want to emphasize, see the circle up there? That's where you can put your logo. Again, these are designed so you can brand them. And we thought this was important. This was an idea that emerged from the advisory board early on, is you've got to make this stuff that people can really, take ownership of. Now, this next slide I want to call special attention to. On these 57 slides, I don't know what your experience is like, but I can tell what mine's like. Somebody else's slides are useless to me if I don't know what's in their head. So for every one of these slides, if you'll look where the big circle is, we have written what amounts to a script for each slide. And again, it's in the notes section. You don't like our words, you can substitute your words, but we didn't want to just leave you at the mercy of the court here. We wanted to give you some ideas, some talking points, some starting places for each of the slides. Now, if it's a title slide, we didn't annotate that one. But for all the ones that require that, it's there. So again, we wanted to make it as easy as possible on you to repurpose and use these tools. And where appropriate, we know that some of these pieces of information are going to become outdated in the out years. So we have a link in that notes section where you can go back to the original website. Maybe it's the annual Medicare report on U.S. healthcare spending. Well, it kind of gives you a clue of how you can go back and get that information the next year in case it's become outdated. Again, pay special attention to the notes section. That's one of the actual things that took the longest time to do on this project. We actually transcribed a lot of the webinars. We actually did a lot more research. But again, that's what we felt we needed to do to make it useful to you so you wouldn't go, oh, this is great, but I'm not Suzanne Del Banco. Broker briefs. Again, these are 2-pagers, and they cover these topics: payment reform, transparency, benefit design. Again, if you look, we've structured them, again, like before, so you can put your logo on it. And so what's this? That's a little 2-pager that's just kind of an overview on payment reform. I don't know if you remember the article from Health Insurance Underwriter, but it was adapted from that, one of the introductory materials. But again, I want to stress, it's in a Word document, so you do have the ability to go in there and put it in your voice if it's not your voice. I mean, this is something that could be used for a byline. It could be used in a local, maybe your state chapter's newsletter. Maybe it's something you want to put your logo on and hand to a client that says, what the heck's going on with all this payment reform stuff? So again, it's designed for you to be able to use it.
Excellent.
Infographics. We couldn't do them all, but we picked 3 things that are in a lot of wide conversation out there right now. One is just this whole idea of moving from volume to value. What does that mean? This is a simple infographic you can put down in front of a client or even post it on your website. And again, you can put your logo on it up in the top right-hand corner, but it explains what the volume to value transition means. It explains what reference pricing is. It talks about what is a bundle payment. So again, infographics, simple, you can rebrand them, lots of different purposes. We mentioned the toolkit developed by Catalyst for Payment Reform. This is actually a screenshot of their website, but on the NAHU Foundation website, there's a document explaining what these tools are. It has links to all of them, and again, this is the model contract language, the model RFI. It's the tool for assessing your market. And I think there's some things that if you really want to get into this and download their survey tools and their other stuff, and that's probably something that's more in the realm of a bigger outfit and probably not something that a two-person shop is going to do. You can actually sign a user's agreement, and you can actually contact Catalyst for Payment Reform, and they'll help you implement the tool. As she pointed out, this is the business that they're in. Finally, this is the glossary I talked about. It was developed by Harold Miller at the Center for Healthcare Quality and Payment. Harold is one of the leading experts in the country on this topic and has written extensively. His website is just, I mean, if you're a wonk on this topic or you're really somebody that's trying to structure one of these deals, his website is a go-to website, not just for the glossary, but for everything else. For instance, he has been one of the leading critics of the way CMS is going about doing its bundle payment program because he doesn't feel like it structures the incentives in the proper way. He's got a whole series of papers there on how to do bundle payments right, how to do ACOs right. He's done, if you have providers in your market, and a lot of people tell me one of the biggest barriers to talking about payment reform in their market is providers. He's got a series of papers that explain how each different kind of provider organization can engage in that.
Yeah, I want to mention something with that because I think a lot of you are going to encounter provider pushback. And I know when I've talked to my own providers about this, for example, on bundled payment, many of them, their only experience with bundled payment is what they've experienced through CMS. And so they automatically think that that's the only way bundled payment could work. So I think bringing these other ideas to the table and making sure that you reach out to your provider community is going to be an important part of this. We've been talking all along about reach out to your clients, but we're going to have to get cooperation from the provider community or none of this will work. So I know many of you have those relationships already. Let's take advantage of them and say there's more than one way to do this. Let's do it the right way, and let's try it until we get it right, because these costs aren't sustainable for them either.
As anybody in this room is probably familiar, while we're on the topic of bundled payments, I'm sure you've heard a lot of this from carriers you work with. What they have is an accounting system that works for fee-for-service. And so when they're trying to do some of these new things, what they're having to do is go back and do it retrospectively or make it fit, or they say my accounting system won't accommodate that. Well, some very interesting developments in the market. I don't know how closely you all follow this, but Horizon of New Jersey, for instance, and North Carolina Blue Cross Blue Shield is on the way to doing this. They worked with a vendor to develop a custom software package to solve the problem, and so there's no more excuses about it can't be done. And they've rolled it out, and so it's actually taking place in the market. But that's the kind of thing that we hope to point you to, not only by pointing you to things like Harold Miller's website and the glossary, but the next thing here, which is the resources guide. It's 25 different things. It's everything from an in-depth paper on bundled payments to the Milliman cost index. It's just a lot of resources that if you're in one of our webinars and you wonder, well, gee, I want to know a little bit more about that. I see the citation for the CMS Healthcare Cost Index. What's that all about? Well, the resources guide, if it was a resource that was central to the webinar series, it's got a short description of the resource and a link to take you there. So anybody that's looking for a way to put himself or herself to sleep at night, a lot of the resources in this package.
I know we have some wonky people out there, and those that are listening as well. It's this is some of this is really interesting. Yeah. So the things that pique your interest as you go through, make note of them, because we have extra information on every topic.
Right. And one of the other things about the way we structured the slide deck, by the way, is by writing the notes section in depth for each slide, it's almost like a miniature way to take the course. I mean, if you really want to, if let's say you have a client that's not going to watch 8 webinars, but they might be interested enough to want to get the overview, they can literally go through and read the presentation not in the presentation format, but in the format you would use to write it, and they can read all the notes and see what each slide means, and it's like taking a little course, because it's got a narrative built in, and you can just scroll right through it, and it's like going through the whole series and fast forward.
It's really good. You're going to be impressed, and I know that you'll like this, and I know it's going to be useful to you. You'll like it.
And I think that's the overview of the toolkit, Janet.
Well, you've just done such an amazing job, Chuck. I can't thank you for all of the work that all of you have put into this.
In that regard, in addition to all the people we thanked before, I'd like to thank some of my colleagues. And again, another shout out to Deborah Cook of the Educational Foundation.
Deborah. Let's not forget Deborah.
Exactly. She shepherded this thing all the way through. We got a lot of great advice from Jennifer early on. Wait a minute. It's not Jennifer. It was Jennifer. Mm-hmm. A lot of great advice from Jennifer early on. In fact, she was tough on us. And my colleagues, Phil Newland, Rebecca Porterfield, Michael King, and others who helped us pull it together on our end. I'd really like to thank them for sticking with this thing, because it was a real labor of love for all of us.
And of course, we can't do any of this without you, and we've done it for you. So I hope that you'll find it a valuable tool. I hope that you'll use it. And I hope that you'll continue to give us feedback about the tools that we've created, how we can tweak them to make them even more useful, because we're willing to do that, and what other things would be helpful for you to have a similar depth of information on, because that's our intent, is to help you be better at what you do. And we know that your biggest concern is to help your clients and your community, and to ensure that people can pay for their health care by using you and by using your services.
And I'd like to just put in a word. I mean, what we're going to turn to next is dissemination and promotion. I'd like to ask each of you to use your own social media. If you have a Twitter account, if you're on Facebook, if you are a member of your state chapter. This might be good information to take back to your chapter. Have your chapter put something about it in the newsletter. We're working with Deborah to provide, little blurbs and information about it. We've got a flyer about this, but I'd encourage you, if you think this is a tool that would be useful to yourself, please introduce your colleagues to it, because we didn't do this, just to have it sit on a shelf. We really would like to see it used, and the only way it'll be used is if people like you say, this is useful and endorse it and encourage your colleagues to do the same.
Great. Well, thank all of you very much. We're at the end of our time, and we appreciate it very much.